Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So, let's take a look.
Hi everyone. Today, we're going to explore everything you need to know about Panclasa, a medication that may sound complicated, but I'm here to explain it in a simple way. Panclasa, made up of fluoroglucinol and trimethylfluoroglucinol, is your ally for relieving certain spasmodic pain. Whether you have irritable bowel syndrome or menstrual cramps, Panclasa can help you cope with those uncomfortable moments. So how does Panclasa work? It acts directly on the smooth muscles, reducing spasms without affecting normal bowel movements. This means it helps relieve pain without causing further discomfort. Let's talk about the dosage. For adults, the usual starting dose is 1 tablet 3 times a day. It is important to follow your doctor's instructions and adjust the dose as recommended. Remember that correct administration is key to effective relief. But what about side effects? Like many medications, Panclasa may have some, such as mild gastrointestinal symptoms and allergic reactions. Pay attention to any unusual reactions and consult your doctor if you experience anything out of the ordinary. In short, Panclasa can be a great help in controlling spasmodic pain. Just make sure to use it responsibly and under medical supervision. Stay informed and healthy. Thanks for joining us. Don't forget to consult your doctor to get personalized advice. See you next time.
If you've made it this far, let us know in the comments why you're using this medicine.